Hello, friends. Welcome to the Ancient Health Podcast, where East meets West. I'm your host, Dr. Chris Motley. Today, we're going to talk about heart flutters, heart palpitations, chest tightness, heart conditions, and how they're directly correlated with UTIs, kidney infections, bladder infections, or kidney stones. There is a direct tie and collaboration between these two organs. So if you are an individual that has had chronic heart flutters without explanation, you go to the doctor, they tell you that you have a perfect EKG. They say that your heart stress test is normal and great, but you still have palpitations, maybe some tachycardia. You get brain fog at times because the chest tightness comes, the flutter comes. You get a tingling in your head, your hands, your feet, and you feel out of breath. Then you go and they say everything is fine. Please look into your health history and get your urinary tract system checked out. And that's what we're going to talk about. We're going to talk about how you can use a test called a UroKey, UROKEY, by a company called Microgen DX. Microgen DX, it's a lab out of Texas, and they'll test for over 50,000 different types of infections. I've had patients that have gotten normal UTI test, and the normal UTI test says it's normal. There is nothing there. There's no heavy amounts of E. coli, because E. coli is the bacteria that they always normally check for, and that's about it. Sometimes they'll check for strep and staph. And if you don't have that and your urine looks decently yellow, they say you don't have a UTI. To me, in my opinion, that's something that is very much overlooked. I've had many patients that have been told they didn't have a UTI, and then we did the test and they found they had some form of a Pseudomonas, or they had a form of strep. They had different bacteria, that some of them that are so rare, but they're in such high amount up in the ureters, the kidneys, the little tubes from the kidneys to the bladder, the ureters, right, and the urethra. All these areas can contain those infections. And they can build up and they can create proteins, coatings on their skin, on their cell surface, and they can attach to the surface of your bladder, your kidneys, or ureters, and they get very sticky and they don't want to peel off. And so I'll find individuals that have high amounts, and a person can make a decision if they want to go get a antibiotic and get it cleaned out, and they've done that, and it's worked wonders. And the small signs and signals of the UTI, which they thought were just happenstance things that were happening in their life. For instance, if you guys can see me on the video, chronic low back pain, especially underneath the ribs, flank pain, the flanks right around here, underneath the ribs, around the back, chronic hip muscle tightness, always tight hips. You can never loosen up your hips. You always feel super tight, the hip flexors, dark circles underneath the eyes, dark rings underneath the eyes, chronic arch pain, chronic heel pain, cracked heels, chronic calf muscle tightness. All of these are signs of kidney fatigue and imbalance and bladder imbalance, because the kidneys drain the urine right into the bladder holds it and then expels it. They're the urinary tract system. If these are the symptoms you have, and you have the heart flutters, it is because the kidneys and the bladder are affecting the heart. Now, energetically, the kidney meridian, if you guys are listening, the kidney meridian starts right at the ball of the foot. That's why when patients say, I have arch cramping, I have a Charlie horse in my foot, I have heel pain, I have cracked heels, I know they have a bladder or kidney infection. And the meridian goes right from the ball of the foot, the little line of energy, and it circles right underneath the foot, up on the inside of ankle bone, goes right up on the inside of the shin bone, on the inside of the leg, up on the inside of the leg, all the way up through the groin area, and it eventually goes right through the chest area, all the way past the heart, around the heart, and up to the collarbone. Now, since the heart gets electrical energy, that line of energy of the kidney feeds the heart. Feeds the heart electricity. It helps the blood flow. It helps the lymph flow up the body on the inside of the leg. It's the return valves going up. If the kidney is weak or fatigued, it will not send electricity up to the heart, and the heart suffers. So the heart will feel weak and tired, and you'll get a heart flutter. That's one possibility. The other thing is that if you really study embryology as an embryo, and this can be a little overwhelming, and I don't want to get boring for everybody listening or watching, but when you form in the womb, they have documented where as you're a small being in the womb and you're unfolding eventually to create a human form, there's a kidney tubule, like literally a tube that becomes your kidneys and your urinary tract system. So the kidneys are formed, the prostate in males, the uterus, cervix, all these in the female. And this little tube becomes your actual kidneys, and it becomes your reproductive organs as well in the male and female. So they're directly connected. Your urinary system and your reproductive system are connected because they're made out of the same cell tissue while you're an embryo. So whatever happens in your kidney system will affect your reproductive system. And your kidneys act as a storehouse, not only of electrical energy, of electrical battery power. That's what the kidneys do. They also help supply and nourish the heart with blood. I don't want to get too entailed with some facts in embryology. It can get a little boring, but basically you have so many branches of arteries that are branching off the aorta area, the aortic artery. And if you can imagine that you have that big, long aortic artery down the center of your body, it branches to the two branches that go towards the legs and go down the legs. But remember, the kidneys are branched off the aortic area. They're also attached to the veins. So if you can imagine, you have two little arms sticking out of your aortic artery down the center of your abdomen, and they're holding on to the kidneys. And that connection is also basically supplying small little arteries that are going to the intestines, to the prostate, to the cervix, to the uterus, to the liver. All these little branches are coming off the aortic artery in your abdomen. Can you imagine that? But those two big branches are going to your kidneys. So what happens is the kidneys become this center point of the movement of electricity and blood flow right in the middle of your abdomen. There is physiological connection about how your kidney strength and well-being helps with the nourishment of blood to the heart. I can get to the very, very details of it, but I just want you to know this. Your heart depends on the actual physical strength of the kidneys to help its strength and its own action. If your kidneys are very, very tired, it will affect how hard your heart pumps. Let's give you one example, okay? When your kidneys are nice and strong, they are balancing the fluids in your body. They keep the water in your system. They keep the water in your muscles and tissues balanced, as opposed to how much water is in your blood. Does that make sense? So you have your arteries, and your body will allow a certain amount of water, fluids, to jump into the artery to give you enough blood pressure. I hope you can imagine that. So your kidneys take all your fluids, and they will balance not only the amount of fluids going into the muscles and the tissues in the extracellular space, like in your actual physical tissue, but also the amount of fluid that is basically giving thickness and pressure in your arteries and veins. So Chinese medicine, if the kidneys are fatigued, they can be overflowing with water, which means they could be so weak that they're not putting enough water and fluid into your arteries. And so your blood pressure, the pressure in the artery, decreases because there's not enough fluid in the artery or the vein. Does that make sense? So the kidney's so tired that it starts allowing fluid to what? Overflow into your tissue. That's why when you get on a plane and your legs swell up and they get balloon type when you get up to a certain altitude, or you find that intermittently my ankles are swelling or my ankles and calves are the same size, I get fluid buildup around my lower extremity. That's because the kidneys are tired and fluid is spilling over into your tissue. It's not going into your bloodstream. Then your blood pressure drops. It's just like a hose. Imagine a hose where there's not enough water in the hose. And you know, when it's laying there on the ground and it's crinkled up and it's there's the circular pattern of a hose lying on the garden floor. And if you turn the water valve opened up and you get more water into the tube, the pressure increases, and eventually the tube will start to extend, and you start to have high amount of pressure in that tube, and you get really good outflow. What happens, though, if there was a lot of pinholes in that tube? The water would be exiting, of course, and what would you think? Well, there's no pressure in the water hose, so there's no pressure at the very end, so I can't push out enough water. Very weak. That's what happens to the heart. So you get lower amount of blood pressure because the kidneys are weak, right? And this water pressure, or this pressure, within the arterial system, the blood flow, the blood pressure starts to drop, and people get faint and lightheaded because there's not enough blood going to the brain, not enough blood going to the extremities, to the feet. So you get cold hands and cold feet. All from weak kidneys from an old UTI, a bladder, or a kidney infection. Yes, all of that. So you have a decrease in the pressure. The heart suffers because the heart picks up on this. This is basic physiology. So the heart picks up on it. And so the kidneys are monitoring this all day. And then the kidneys will release what we call renin. And it signals up to the lungs. So what the kidneys do is it's trying to get recruitment. It is trying to tell the body, blood pressure is low. I don't have enough blood pressure to run the system. But remember, the kidneys are infected or diseased, and we're going to get into that about infections. And it could be emotions too. So we're going to talk about that as well. So you have emotions or infections that are weak in the kidneys. They're signaling to the body we don't have enough blood pressure. Then renin, a hormone, is released up to the lungs. And the lungs basically are signaled. So the lungs will release angiotensin, which is angiotensin. So it tells the arterial system to do what? To basically pick up the pace. It will make the arteries constrict because it's angiotensin. So angiotensin is released in the lungs. And this will signal to your heart that we have to have higher blood pressure. We have to increase the strength of the heart, the contractile force of the heart. So there's this connection between your kidneys to your lungs to your heart. So the heart starts to overwork. Does that make sense? Your kidneys are picking up on this low blood pressure because the kidneys are diseased. And then the heart at the end of the whole cascade is having to work harder to pick up the pace because the kidneys are infected. So the heart's working harder, picking up more pressure, contracting harder to push more blood through your arteries and through your whole system so you don't pass out, so you don't have cold hand and cold feet. But what happens to your heart when it's working all day? Literally just consistently working. The heart wears out. So the heart gets fatigued. It starts to get stressed over years. Now, as it starts to get stressed, you can start to have chest pains. You can start to have flutters because the muscles in the heart start to cramp. They start to get worn out. That's just one physiological connection between the kidneys and the heart. So let's back up. So everybody out there is going, oh yeah, I could see that physiologically and, mechanically. I love mechanics. That's how it works. That's one aspect. But if you back up and go, okay, what about the infections within the kidneys? The kidneys basically are a filter, and they will filter out infections. So people who have had, this is an example, infections when they're young, like strep, chronic strep or staph, strep throat, staph infections in the mouth and the nose, like Marcons, like staph resistant to antibiotics that are up in the nasal and eye area. All that stuff is draining down your throat, through your lymph nodes, down through your chest area, through the lymph nodes. It eventually dumps into the heart because why? The heart is where the lymph eventually settles in. And then it has this whole cascade where you're trying to take all that old infection from your lymph through your heart. It goes to the liver. It'll go to the bowels. It'll go through your kidneys, trying to flush all these toxins out from your blood. Your blood's trying to help you. So let's say you just had strep or staph. I have found so many individuals that have so much strep in their kidneys because they had chronic strep over and over and over again when they were young. So if you know you've had pandas, children will have pandas, or you had it when you were younger and you knew you did, or you had chronic strep throat, chronic mono, and you get up every morning or every evening at night and you're peeing every night consistently. I have to get up 3 or 4 times in the night to pee. I have dark circles under my eyes. My calves are always tight. My heels are always tight. They hurt. They're cracked. The arches of my feet always bother me. My hip flexors are tight. This means that you've had infections settling into the kidneys. I literally have children that are 2 or 3 years old and they have chronic kidney infections even though the urinalysis says, no, it's not there. This is not to say that I'm bragging about myself. I'm just saying that we have to look for things like this. Thankfully, we found this on young individuals. We clear them up. Their bedwetting goes away. Their chronic fatigue in the afternoon, the kidney time of the day is settling down, and their heart function, their cold hands and cold feet, their cognition gets better because you heal the kidneys. So the kidneys can hold on to these infections. Lyme disease can get in there. Parasites can get in there. The kidneys will attract a lot of these infections. They settle in there. It destroys or hurts the kidney's ability to actually filter out minerals, filter out calcium, magnesium, potassium, to keep that balance within your blood, your tissues, and the urine. So if the kidneys are infected or they're injured, they can't do their job. So you could have imbalanced calcium, potassium, sodium levels, and your body has to keep it balanced or you'll hurt yourself. People die from this. So your kidneys are wearing out all the time from this. So if you know you had a chronic infection when you were a kid and you had the symptoms I just talked about, you need to go get a UroKey test to see if you have a urinary tract infections that's hiding. And one of the things that I'm so adamant about, and you hear in my voice, is because the kidneys, if they get chronically infected by an infection, it could lead to emotional issues. It could lead to depression. It definitely can lead to chronic fear. Kidneys are always related to fear because the kidneys, if you can imagine, picture in your head, kidneys sitting there, has this sheath of fascia, connective tissue around it, and right on top of the kidney is where the adrenal glands sit. On both sides of the aortic artery, right in the abdomen. The adrenals and the kidneys act as a unit in Chinese medicine. They are responsive to stress. So not only could you have an infection in there, but it could affect your kidneys, your adrenals, like the cortisol and adrenaline levels in your body. So then you could have imbalanced cortisol levels, adrenaline levels. You could respond quicker to stress. You could have what? Fight or flight, anxiety, fearful. Why did that get my attention so quickly? Why am I so jumpy? Why am I so afraid? Things did not scare me when I was a kid. As I've gotten older, I have to urinate all the time. I cannot hold it in. I have to go pee right now. And I get startled and I scream quickly, fast. I can't watch. I don't want to watch horror movies anyway, guys. But I don't watch horror movies because it startles me. If that's you, this is probably what's happening. So this can create emotional distress in the fear, dread, bad recall, memory, night terrors. And if you have bad night terrors or dreams and fear, definitely kidneys. So you can have this infection. It can be many of the infections, but I say start with the bacteria. Then I would say, if that doesn't show, I would get checked for chronic candida or fungus. And the good thing about the UroKey, it does check for candida and funguses as well. If that isn't there, then I would check for parasites. Then I would go into mold. And if it's really, really stubborn, we may have to check for a certain type of Lyme viral connection. Many practitioners out there, if you're listening to me, I know many of you guys out there have your own protocols. I respect it. I love it. We all have to stick together. I don't want to say my protocol is better than anybody. Never would I say that. I just want us all to go we had to clean the kidneys. The other aspect, I know many of the practitioners probably have got great stories, is that individuals that have been raised in fearful situations or in a household of fear, a household of dread. If you've been in a relationship with a girlfriend or a boyfriend or a spouse and it was based on fear, you know what I'm talking about. Your kidneys are basically going to respond to the energy output of the adrenal glands. That's what the kidneys do. They're sitting there in one unit, and that energy drain from somebody or something in your life that's made you fearful or afraid all your life is draining the life out of your adrenals, and it's causing you to have cortisol and insulin and adrenaline imbalances. And this, what does adrenaline do? Makes your heart beat harder. Fight or flight, right? All of this is getting that heart-kidney connection worn out. And then as the adrenal glands start to wear out, you go into what we call adrenal, not failure, but adrenal triad syndrome, adaptive triad. The adrenals just get worn out. The kidneys start to get worn out. So a funny thing happens. This is like German medicine, and this is really what happens, in my opinion, with physiology, okay? And this is one aspect, and I love your guys' comments, so send me more if you guys have extra insight. But think about this. If your kidneys and your adrenals are always responding from being in a bad situation, a fearful situation, they're going to try to get stronger initially. They're going to try to grow. They're going to try to handle the stress. So any organ that works harder will grow in size. But they can't grow too much, because if they grow too much, it'll get too big for your abdominal cavity or whatever cavity it's in, and it will overgrow. So the body will send, this is one argument for German medicine, is the body will allow certain bacteria or viruses or yeast or mold or parasites to sit in those organs to help break them down so they don't get too big. So that when the kidneys are getting ahead of themselves, or the adrenals, the body allows some of the strep or some parasite or something to stay in there because it's helping the body out, because the body doesn't have enough energy to fight everything off itself. So then you could have a chronic recurring infection in those organs just to help you balance your emotional and mental stress. So if you're raised in a family or a history or a relationship that had fear, you have to go get maybe some talk therapy, eye movement therapy like EMDR. I would suggest it. Neurofeedback called lens therapy, LENS, lens neurofeedback. I love it. I do it every week. One of my favorites is NET, neuroemotional technique. If you guys want to see more about that, visit Dr. Vivian Cairo at Dr. Vivian Cairo. Social media, you can look at Dr. Sam Riley. They're great friends. They do awesome with NET. And you can't use the acupuncture system and physical manipulations and adjustments to actually help you with regulating those emotional patterns. It can be done. I do it in my office. You need to break the cycle of the emotional fears. So you take a break on the kidneys don't keep growing, and then you don't keep putting those infections in those areas to help you clean them up. So you have two aspects, whether it's fear or dread or bad memories that are basically holding on to you when you're younger and it's causing this cascade, or you were raised in a moldy home, or you're around a family member that had strep all the time, or you had Lyme disease. The biggest key is to find out what's going on in the kidneys and clean the kidneys out. If you get that area down, that's the one simple thing I wanted you to take away from this. Clean your kidneys out. So I suggest Uva Ursi. I want you to write this down. Uva Ursi, UVAURSI. Uva Ursi Supreme by Supreme Nutrition Products. We'll put that link in the show notes. I love to use Bodyguard Supreme, which is called Chanca Pedra, which is Stonebreaker. I love those. Those help clean out the kidneys well. You can also use cranberry mixed with D-Mannose. Those are simple ones right there. There are kidney formulas in Chinese medicine that we can go over, but many people want to keep it very simple. So I always say Uva Ursi, Bodyguard Supreme, cranberries or cranberry juice or cranberry capsules, and D-Mannose. There are so many more herbs, but I want to make it very, very simple and clean for us. So whenever you start to clean the kidneys out, you'll start feeling a reduction in the foot pain, the arch pain. You should start feeling like your calves and your heels are feeling better. You should start seeing the darkness underneath the eyes start to fade. You probably feel like your hip flexors are getting looser. And you'll notice that your startling fear reduces. And when you see this, you'll start to feel like, oh, I'm feeling a little bit more normal. And all of this to say, your heart will stop fluttering. It will stop jumping. Your heart palpitations will go away. This is what I believe. I've seen it so many times, but you'll start to notice it. You're going to notice that your kidney ratios, your albumin levels, all of those are going to get balanced in your blood work. So I want you to please analyze your kidneys if you have heart flutters, heart palpitations, or if you're fear for your heart. Analyze your fears. Check out those emotional techniques I talked about. They'll be in the show notes. I want you to start talking to your heart. I know many of you out there are probably laughing, probably just, whatever, talk to your heart. Seriously, at night, in the morning, I don't care if you're a guy or a girl, I'm serious. You put your hands, both hands, cross your hands over your heart. Connect with your heart and ask your heart, why am I afraid? You'll be surprised what you hear. This is all from heart flutters and palpitations. The reason I'm so adamant now is when you're healthier and you're younger is because when you get older, your heart will get worn out and the heart gets upset because you weren't listening to it. That's why people die of a broken heart. If you listen to your heart, it'll tell you what's wrong. Guys, there's a lot of information, but I want you guys to check this. So please, if you know anybody that has heart palpitations, chronic heart issues, chronic weak heart, you can't understand why your heart is so tired, get the kidneys cleaned out. All right. This is all to help and encourage. If you know anybody that wants to like and subscribe, please keep sending them the podcast, like and subscribe. I'm so thankful for everybody listening, and I'm so appreciative to all of you. If you want to know when a new podcast comes out, hit that bell. It'll tell you when a new one comes out. And just remember, if you have any questions about herbals, look at Supreme Nutrition products. And they have really great products, really good products on their website. Anyway, guys, I hope that you have a blessed day. Until the next time, we're going to probably talk about liver on the next podcast. But if you have any questions or comments, send them our way. And we'd love to know about what you guys want to hear about, not only like in a Chinese medicine aspect, but in the frequency medicine world. We want to give you like different angles about health. All right. So keep in touch. Thank you guys so much. Love y'all. Take it easy.